So hysterectomy is a procedure where you remove the uterus. Benign disorders that we typically do hysterectomy for could be things like uterine fibroids, could be for endometriosis, could be for heavy menstrual bleeding, could be for pelvic pain, which are all benign conditions that are not life-threatening but nonetheless cause problems in a person's daily life. It's traditionally been done in one of two ways, either abdominal hysterectomy where you make an incision on a person's belly and you remove the uterus through that incision, or vaginal hysterectomy where you make an incision on the opposite side through the vagina and remove the uterus from the vaginal side. Now we have the ability to do something called total laparoscopic hysterectomy, where we do the entire surgery abdominally through the camera, and all we do is we use the vagina as a vehicle of removing the uterus out of the abdomen. Back in the old days when you had hysterectomy, you pretty much were not able to do too much for about 4 to 6 weeks. With laparoscopic hysterectomy, because the incisions on the abdomen are very small, you're able to go back and return to a more normal life much more quickly, typically 1 to 2 weeks. We still have certain restrictions. We don't like people lifting anything greater than 10 pounds for about 6 weeks, but if you have a fairly sedentary job where you're sitting at a desk working on a computer, you can potentially be back to work in 2 weeks.